Welcome to the office. Stephen, welcome to the office.
Nice to meet you.
Nice to meet you too. So you're coming from Fresno.
Correct.
Why are you driving all the way from Fresno to LA?
Well, I came to see you about deviated septum.
Okay, talk to me about the septum. What happened?
From what I remember, and this memory occurred recently, but when I was younger, about 15 years ago, I had a door open, so I was on the inside, and it hit this side of my nose.
Okay.
And I think since then, that was the moment where I started having we thought it was allergies, and I had a lot of sinus problems and sinus infections during the winter time.
Since then?
Yes.
Okay.
And I think I've come to realize that, I did went to see some professionals for allergy tests to see if I was allergic to anything. So when I did the test, it was nothing.
Okay.
So no big allergies. But they did.
But you're getting sinus type allergy symptoms?
Yeah, stuffiness, congestion, kind of pain like up here, headaches a little bit right there.
Only during the winter time?
It's worse in the winter time.
Okay.
But the congestion is pretty much year round.
You have it right now too, right?
Yeah.
Okay. And that's kind of your normal?
Yeah.
Okay.
And I've noticed lately in my life, the past few years, when I sleep, I've become kind of a side sleeper. I think I always was.
Okay.
But that's
right side, left side?
Well, so I start out on my right side, and then that kind of clears up this side of my nose. But then I think once I fall asleep during the night, I'm kind of tossing and turning. People tell me I snore.
And this has been going on since 15 years ago?
Yeah, but I think it started picking up once I became an adult. I started to notice it more, or maybe I just became more aware.
Okay. So number one is the deviated septum. That's creating the allergies and sinus issues?
Yes.
Okay. Any other issues going on?
So I've been having some discomfort kind of up here between my shoulder blades.
Okay.
And now I'm really kind of moving around in the chair, kind of trying to find a good position, stretching.
So you're not finding a position of comfort?
Not for very long, no.
20 minutes, 30 minutes? About that?
About that, yeah.
All right. Anything else going on?
Nothing major, I don't think. Just
so whatever I
pops
find,
and cracks here and there.
Okay, whatever I find along the way, we'll go over it. Okay.
Okay.
Yes.
I should probably tell you, I did play tackle football for 8 years.
Okay, well that kind of helps, guys. A little tackle football, high school.
High school, and then 4 years before high school.
Oh, right on. Okay.
Yeah.
What position?
I played a lot of positions, lineman mostly, but I did some linebacker and some fullback.
Right.
Any position where you don't have to run fast.
But you took some hits.
I did, yes.
All right. Okay. And that nose didn't happen during football?
That's what my mom says, but I'm not so sure now.
Okay.
After, yeah.
Well, maybe all of it kind of compounded together.
Maybe
the door started it, and maybe football exacerbated it.
Possibly, yeah.
All right, and you know what I do here, right?
I think so.
Okay, you've watched videos, you kind of know how I work.
Yeah.
We're going to go over your x-rays, I'm going to explain all the things I see. Obviously, I look at the whole body, starting with the foundation, working my way up, right?
Yeah.
And we'll deal with the nose today also.
All right.
Sound good?
It does sound good.
If you have any questions along the way, please stop me, please ask. Something doesn't make sense, I need you to understand what I'm explaining, okay?
Okay.
So once you understand, we go over it, we move forward.
Got it.
Okay, makes both our lives a lot easier.
On the same page.
Okay, let's do this. Let's go over your x-rays. This is your back profile, this is your side profile. And when we're looking at the side profile, first thing we want to know is, do we have our 60-degree reciprocating curves? And we don't really have the right curve that we want in the low back, okay? And we're going to go over that in more detail. And I want to zoom in on this low back curve. Because when we look at this curve, it should be doing what? It should be curving this way. 5, 4, 3, and then all of a sudden you're starting your thoracic curve at L2. And that's where your kink is right here. Okay, whatever happened. And I'll go in more detail in that. Let's go over here and let's take a look at your foundation and see what we got going on. So the first question is, do we have a level base and foundation? That's number one. And let's take a look and see if we can notice some subtleties here, okay? This obturator looks smaller, this obturator looks bigger, yes? This looks slightly down, this looks slightly up. Okay? Now, it looks like a slight little bend in the tailbone here. Slight little bend right here at about S1 to S1, S2, S3, right around S3.
Okay.
Okay? You see what I'm talking about here?
That's S3.
So let's do it this way. When we're looking here, this is supposed to be our L5, okay?
Uh-huh.
L1, L2, L3, L4. And so we have 4 lumbars that move. Your 5th lumbar is considered a transitional bone or a transitional segment. And it's in about 10% of the population. So let's draw this line first. And then if I zoom in,
So when you say transitional, is that what it normally is, or is that the 10%?
that's the 10%. So
Okay.
you have, if we look at it, your L5 has taken on more of the characteristics of the sacrum. So it looks like you have a slightly larger tailbone.
Okay.
That person needs more flexibility, okay, versus the one who has 6 lumbars, and that person needs more back strengthening or strength training for the low back. So one of the things moving forward for you is going to be more flexibility stuff. Okay, we'll talk about that later.
Okay.
That's not why you're here, but I'm pointing it out to you. Makes sense?
Yeah.
Now, the other thing, the other finding is this, and now I'm pointing all this stuff out because that's what I do, right? This right here, that's spina bifida, and that's another anomaly X-ray finding. And what that is during development, those lamina should close together and form those bumps on the back. This one failed to close. And so I'm going to touch it, it's probably going to be tender. It's not a cause of anything, it's a finding.
Okay.
But I'm sure if I touch it, it's going to be tender. And I get a lot of patients that have it where they go and without an x-ray and someone touches it, oh, that's the problem, that's the problem. That's not the problem. The issue we're going to find is lower down. But I'm going to tell you right now, when I touch it, it's going to be tender, and I'm telling you why. Okay?
Okay.
All right. So if that's that, let's go. This is supposed to be our L5. Okay. This is our S1. S2, S3, S4, S5. Okay? So what I'm trying to show you is that's how they're supposed to line up.
Yeah, it does look crooked.
Alright, and this is the one. So this is 5, 1, 2, S3, S4. Okay, it's probably where we're going to start. I don't know until I examine you.
Okay.
Okay, let's work our way up, please. As we go up the spine now, let's see what we got. So we have the transition that goes here. Now, the overall picture is what? You see how it curves, and then it curves again. So we have a lot of compensations. You took some good hits in football, dude. You took some really good hits in football. And you can see the kinks back over here. Now, as we go up, there's the septum. This is the right side. Okay, this is the left side, and there's the slight bend there. You see this?
Yeah, so it bends to the left.
Yeah, so if this is the right side, yeah, it's bending to the left side, which makes sense.
Mm-hmm.
Now, typically we're going to be working on the high side of the rainbow, so if it bends that way, we're probably working left to right. Does that make sense?
Yes.
Okay. You also have jaw deviation. You have had some jaw issues. You did get stuck in the jaw a few times.
Yeah.
You can see the jaw here, and the way I see it is this. We can look at the ramus of the mandible. This side, this is the left side, the right. You can see the right side looks thicker than the right side.
Left side.
The left side looks thicker than the right side.
Okay.
And that's because of the rotation. So the right side comes down, left side compensates in order for, and some people think it's normal. It's not normal, meaning it's not, everyone has some variations, okay? Everyone has some sort of variations in there. However, when I'm looking at this all contributes back to your trauma or football. and that can all lead to whatever symptoms you're experiencing. TMJ can contribute also to sinus issues and allergy type issues, and let me show you how. If we go over here, there's a little, right behind the TMJ is a big ganglion that sits there. There's all these cell bodies, and it's called a pterygoid palatine ganglion. And it sits right behind that condyle of the TMJ. So with misalignment, it can cause pressure there. And that can affect, look at all those things it can affect.
Yeah.
All the glands in the face. So I have had many cases where TMJ actually caused it.
Oh, wow.
I'm starting to put some pieces together for you, okay?
Yeah.
So we're going to look at the TMJ, we're going to look at the septum, but all of that is secondary to the spine. Now, if we look at the tailbone, this is a smooth curve. Right there is where I'm talking about, okay? This area here.
Okay.
Now, we can also see S1 is swollen. 4, 3, 2, 1. Yep, and then the ribs start. Your discs in your thoracic spine are all good here. I'm happy with that.
Oh, good.
Okay, your neck curve is decent. There's a slight kink here at C3, which can also affect the breathing. 3, 4, 5 keeps the diaphragm alive. We're going to check on flexion extension. So in extension, they should all go back, which they do. In flexion, they all go forward. C2 may be a culprit, something up here, but also the upper cervical, that space didn't open up between the occiput and atlas. So there is something going on up here as well. Again, it's all connected.
Right.
All right. So far so good, makes sense?
Yeah.
All right. And let's look at your foundation. This is the key, right? All of this starts as having a level base and foundation. If we don't have a level base and foundation, then whatever I do up in the top part of the building doesn't really hold in this work that we do. So what do we see here? We see a rotated pelvis with a rotated sacrum. The good news is this: you only have a few millimeters. The MD is 3 millimeters. Okay, so there's only 3 millimeter measured difference. I correct the pelvis; it gets to 2. I mean that's fine. There's no intervention. It's under 7 millimeters. Adjustments will hold.
Okay.
So that part we're good at. But it's this rotated sacrum down at the S4, S3 area is what I see. Questions on the X-rays?
No, I think that covered everything.
Okay. And I'm going to have you walk to the corner of the room and back, and let's take a look at your walk. Walk to the corner of the room and back a few times. Just whatever your normal walk is.
Okay.
Okay? And this is your normal walk, right?
Mm-hmm.
Cool. So he has a very stiff or rigid walk. I want to see him moving through the dimples up and down here. Go. You can see that left side just shifts. You shift to your left side because of the fixation. I don't know if you feel that yet. This thing doesn't move, this left side.
Yeah.
Okay. Come on back, have a seat over here, and let's get started. Starting at the base of the neck. I'm actually getting a C3, dude. Interesting.
That's occiput, right?
No, C3, third cervical. And right occiput. Interesting. You said you're getting it between your shoulder blades, yeah?
Yeah.
That's where I'm getting it, around T67.
Yeah, that's a little lower than where I feel.
And all of this starting where? Foundation. And the interesting part is he doesn't have big breaks, okay? This has been there a minute. 10 points, sacrum, S3, S4, left side. So we're getting 3, C3 on the left, occiput on the right, around T67, and S3, S4. Let's go ahead and statically palpate and see what we come up with. All right. Head down, please. Static palpation. And you can see right there is where that edema starts to pool. You can see all the spinuses are missing here because there's no curve. And this is curved. Sit up straight. Even so, this is how he should be sitting. Okay? And even with that, You're not really seeing any bumps back here until right about here, and this is prominent from his posture. Go back to sit whatever's normal for right now. That's your norm, right?
Mm-hmm.
Okay. Is that because of the drive, or just that's your norm?
It might be a little because of the drive, but yeah, I usually I feel like I sink down a little bit.
Got it. 2, 3, 4, 5, 6, 7. 2, 3, 4, 5, 6. 8 more tender, 7 more, 8. 8 more tender or 7 more tender?
I think 7.
7 sharper, right?
Yeah.
Head down, please. Relax there. And he's got that nice dipped in through there. That's all posture. Let's go ahead and check pelvis, feet together. Open and close your knees with your feet touching. Open and close. Right side only. When he does the right, you can see the whole left pelvis wants to shift because of fixation. Left side only. When he does the left, there's also the movement, but this movement is actually coming from up here more so than it's coming from down here. So this whole thing is stuck. This whole thing here is erector. Do the right side only. You see the difference? When he does the right side, it's stuck here, but when he does the left side, the whole thing is stuck. Okay. This is going to be a fun case. Okay. Back slowly towards me. This is L5. Tender. S1. S2.
Yeah.
Tender. S3.
Mm-hmm.
And S4. Not so bad.
Not bad.
S3. S3.
Oh yeah.
S3. T7, S3. Now we'll get to the top, okay? 7, 6, 5, 4, 3. Let's start at the top. This is number 2. Head down, please. Number 2. Number 3. Number 4. Number 5. Number 6. Number 7. 6, 5, 4, 3. I'm getting the pressure at 3. 4. 4. 4. C4 left side. Let's motion the occiput, please. And for the primary motion, bring your shoulders back. Feet out on your heels, please. There you go. Palms up, resting on your thighs. I'm just checking, okay?
Okay.
Let's do primary motion of the occiput is nodding. We're going to do the left side. Left side is good. Right side. Right side is stuck at the end. Do you feel the difference?
Mm-hmm.
Left side. Right side. But we'll check that after C3.
Okay.
All right, let's come up with a game plan here, guys. C3, T7, sacrum. We're going to set S3 as a rotated left sacrum. We do have the pelvis there, and if we look at the chapters in the book says if you have a PIEX on the side of a rotated sacrum to do the sacrum. To do the sacrum. But I'm not working on the rotated sacrum, I'm working on S3. Okay? Once I get that sorted out, then we can go to the pelvis.
Okay.
All right? That's my thought process. Okay, for T7, PLI, T7, and for C4, PLI. But it's in a concavity. So we're going to set it as a PL. Interesting. Okay. Oh, this is a fun case, dude. You don't follow anything in the textbook.
Really?
No.
That's just how I roll.
That's just how you roll, dude, and that's totally fine. Now, before we get started on that, let's check the jaw too and the septum, okay?
Yeah.
Sit back for me. Let's take a look at the jaw. Slowly open the jaw. Slow. Open, open. You can see the right side comes out first. Open, open. This is a right AI, okay? Now, when we look at the septum, we can come a little closer here, see? So we're going to set it from left to right side. He got hit this way, right? That way. And the deviation is there, but the high side of the rainbow is there. So I'm on this part here. Okay, that's the cartilage, that's the bone. I'm not adjusting a bone, I'm not cracking a bone. And then the next thing they say is, well, how do you fix the cartilage? We're setting it to see, and we'll see what happens. Okay?
All right.
In a lot of the cases that I've worked on noses, I've had hundreds of nose cases. And almost everyone has gotten the result they were looking for. Question is, though, what are we actually doing? And is it the nose adjustment? Is it the TMJ? Is it the cervical? It's all connected. You don't ever see me just do a nose, right? It's all connected. So the nerves here control the sinuses. The nerves here controls the sinuses. Sinuses don't work by themselves. They're nerves that control them.
Right.
Does that make sense?
It does, yeah.
So it's all connected together, guys, and that's why we're looking at the whole person and the whole patient. Does that make sense? Okay, you ready to get started?
I'm ready.
Let's do it. Let's go face down over here on the gray table. S1, 2, S3. Now, S3 is down slightly on. We're going to torque up, so clockwise torque. You got it? You good there, sir? And that's the home run, baby. Thanks, Shasha. PLI. 1, 2, 3, 4, 7. PLI. There you go. That was squishy. You good, dude?
Yeah,
Alright.
felt that one.
Sir. They were both really good sets. Come off the table slowly. I'm right behind you. And let's walk it off. And as you're walking, well, let's walk, just walk. Let me open up the back of the gown so you can see. This is after adjustment. Go ahead. A little different,
Yeah.
a little different, a little smoother.
Yeah, it feels like it's moving more.
Yeah. Cool. Now, come back over here, let's run the meter again. All right. Mid back is clear. Sit up straight. Let's check the low back. S3 is clear. I want you to feel this before I continue, okay?
Okay.
Back slowly towards me. That's 5. That's 1. That's 2.
Oh, yeah, better.
This is the one I did though. 3.
Yeah, a lot better.
Tender a little bit still though.
Yeah, a little bit. But yeah, definitely noticeable.
Different. Now let's get to the top. Let's come back over here and let's take a look and see what happened. I have a feeling something shifted. It's down at 6, 5, 5, 6 now. Three, 4 cleared. It's down lower with the occiput. Interesting. This is going to be a C. 5. Wow. Drop it down. Down. Oh. Yeah. Now let's switch strap. Alright, and down, hands on your lap. Put the feet all the way out, please. This one's also light, okay? It's a light. You crack your neck, don't you? Relax the neck. And we've got a lateral to medial, scoop. Butter, baby. Nice. Give that a second. Deep breath in, all the way out. Breathe in through the nose. Slowly open the mouth. Open. Open, open, open. A little different, huh?
Uh-huh.
Uh-huh. A little different. Pretty cool. All right. Now then, what you came for.
All right.
You ready? Let's do it. Now, just from what I did, though, all right, just give me some feedback. Just from what I did. Breathe. Anything different? You want to walk a little bit?
Yeah.
Test it out for yourself, dude.
Yeah.
Not just me telling you, hey, it's better, but you walk it out a few times. All right? Do your thing. See how you feel with that.
I feel when I walk, things are moving a little bit down here. But I think, let's see. Yeah, I feel like it's kind of coming up here a little bit more.
You're moving through the joint a little bit.
Yeah.
How about the breathing, dude? Through your nose, through your nose. I haven't touched the nose yet, but I'm just wondering if anything changed so far.
Well, I'm getting air through both sides, which isn't always the case.
Okay. It's a little different. Let's go on your back. And we said we're going to do left to right. Slide up, please. Slide down a tiny bit. Chin down. Okay. We're going to breathe through your mouth for just a second. Okay. There you go. Tiny bit more, okay?
Okay.
You okay?
Yes.
There you go.
Yeah, it feels more open. Okay, so jaw.
Have a seat, yeah. All the way back, sir. Slowly open. Open. Am I tripping? Huh. Open. Tiny bit. It's better. Tiny bit. Open all the way. Open. Slow. Open. Slowly close. Hmm. 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 Open. Open. Voila. You keep breathing while I just check some pulses.
Okay.
I gotta do one more thing. I just gotta stimulate a part of the ear for your breath.
Okay.
Just a little bit, maybe a little sharp.
No
Okay?
No problem.
If it's too much, tell me to stop.
Okay. Which ear?
Both.
Both, okay.
But first you tell me, this side is sharper, or this side, or both.
Oh. They both do, but this one feels like more like,
Like a needle.
yeah.
Deep breath in, breathe. Through the nose, brother. Through the nose. Through the nose. Come on, you got it. If there's too much, you tell me. That's pretty cool. Tell me.
I can feel like everything.
Just trying to get your lung pulse back too. That's pretty cool.
It feels like I'm getting more air.
Don't move your chest now. Breathe in, use your tummy, your diaphragm. Are you familiar with diaphragm breathing?
Not too familiar.
So the way you're going to do it is as you breathe in, you're not going to raise your chest. You're going to fill your stomach and have it push it out as much as you can when you breathe in.
Okay.
When you exhale, belly button in. So breathe in, belly button out.
Breathe in, belly button out.
Breathe in, belly button out. No, through the nose. Through the nose. Through the nose. Breathe in, belly button out. Nope. So as soon as the chest rises, stop. It's like this. All stomach, the best you can. That's it. Exhale. Breathe in. Exhale. Breathe in. Exhale.
Yeah.
Diaphragm breathing.
I feel
Breathe
it
in.
there, yeah.
Exhale. You can look this up on YouTube. There's all kinds of people doing diaphragm breathing. I want you to start practicing this and learning this, okay? Breathe in, belly button out, belly button in. Exhale. Breathe in. Exhale. Breathe in. Exhale. Breathe in. Exhale. Don't raise that chest. Breathe in. Exhale. Breathe in. Exhale. Breathe in. Exhale.
I'm getting something kind of right here
What?
behind my shoulder a little bit, just a little feeling when I breathe.
It's probably a rib. Right in there?
Yeah, a little bit higher. Yeah, right there.
Okay. Right there?
Yes, that's
Okay.
it.
Keep going. Keep going. Keep going. Relax it. Relax it. Let me have it. Let me have it. Let me have it. There.
Oh.
Keep going. Still there?
No, that one's gone.
Keep breathing. Not the chest.
Not the chest.
Diaphragm.
It's hard. Gotta train myself.
Yes, sir. And I don't but you're doing a great job today, okay?
Okay.
Deep breath in. And out. Belly button out. Belly button in. That's your homework, okay?
Okay.
Now let's walk one last time. And make sure that your breathing is changed all the way out. Come over here, please. Check the hands. Squeeze. 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 A little bit on the radial head on the left side. Lunate. Squeeze. There you go. Squeeze. Squeeze. So when he squeezes, he goes down like this. Squeeze. Yeah, you see? That goes down. That's all your keyboard now. Mouse, trackpad. Mouse.
Mouse, keyboard, yeah.
Relax there. Let's start on the ulna. Let's do the distal, posterior distal radius. There you go. Posterior lunate. Nice. Scaphoid. Let it go. Let it go. That's it. Go like that 5 times. Squeeze. It's different now. Good.
Yeah, the thumb feels different.
Squeeze. That's where we're going to start for today. Any
Okay.
questions in anything I went over or did?
Maybe about the ears. How did that work?
Turn, face that way.
Oh,
I forgot to adjust the ears. Oh, you were talking about it was an acupressure point.
yeah.
So there's an acupuncture point for the lung field. And I started to stimulate that to help the breath. Okay?
Gotcha.
So between the septum, the TMJ, and that, and the adjustments of the spine, we'll see how you do over the next couple of days.
Okay. I feel like a lot of stuff is waking up, like kind of my face and my breathing,
Good.
especially with the diaphragm.
Good. And what I'd like you to do is steam. And the way I'm going to ask you to steam, and I tell this with everyone that gets their deviated septum or their nose adjusted. Take a pot of water, boil it, cover yourself up with a sheet, take the shirt off, Okay, and sweat out as much as you can handle.
Okay.
I like old school versus the steaming. Some people will get the steam machines, it's more convenient for them. If you can do the pot of water, it's better.
Okay.
For me, for what I want you to do.
I think I'll do the pot of water.
Okay? Welcome to the office.
Thank you. Thank you so much.
You're welcome.